Hi, this is Brandy Babin, Vice President of Clinical Services for Mana Health Partners. I am going to go through today the True RCM section of how to add a progress note for the nurse practitioners. So in order to maintain a little bit of HIPAA, I'm going to share with you a Word document of what it looks like, and then we'll go through and do a note. So let me share my screen with you. And when you log in, this is going to be what your dashboard looks like. And you can see your initials up here, Brandy Babin. And you are going to spend the majority of your time under clinical notes. You're going to write all of your clinical notes and make sure all of your notes are here. So we're going to click on to clinical notes, which will bring us to these three sections. So we're going to click under nurse practitioner clinical note because that's what we are. And then we have the opportunity to either create an initial note or we can create a follow-up note. You've got your name right here, and we're going to create an initial note during this session. So in order to create an initial note, you can either select an initial note that's already been written, and it would have to be written by you. You can't select anyone else's initial note. And then when you do this drop down, you can select that. If you're going to create a follow-up, you can click into select initial note, click create follow-up, and then it will let you use your initial note as a follow-up note. But we're going to create a new initial note here. So when you're done creating the new initial, this is how it is going to look. It's got your name here at the top, the patient's name here, the patient's facility, the patient's date of birth. I'm just going to add the date of service, which is today, January 5th, 2025. At the top of your notes, you've got your ICD-10 and your CPT codes. Those we do at the very end. So as soon as we're done the completion of the note, we'll scroll back up here to the top and we will add these. Each section has a header. This header is chief complaint. There's a header HPI. Some of the headers have red asterisks, meaning they need to be completed prior to closing your notes. And some headers have an I, which is information about what is required in this box. And so this is the chief complaint. You're going to write admission or assumption of care if it is a admission, readmission, or assumption of care, because this will be your initial visit. And then whatever symptom or diagnosis that the patient has. So this would be an ICD-10 code. So this patient is a new admission and the patient's diagnosis is diabetes. When you click on this box, if nothing pops up over here, that means there's no snippets. If something does pop up, that means that there are snippets associated with this section. In the top right-hand corner, there will be a green box right here, and that will upload all of the information from Point Click Care that is required in your note at one time. So when you scroll down, you've clicked it and it will show you the past medical history. It will show you the allergies and automatically drop down into the allergy box. It will show you the code status just with that one button. It will show you the list of medications. It will show you vital signs and it will show you weights. The caveat to the vital signs are that they're only as accurate as the last vital signs that were obtained. So remember when you're doing them to check and see what date they are, and then you will know if you need to obtain additional vital signs. Scrolling back up to the top of the note under HPI, you can see when you click into this box that there are 4 snippets that you can select from. There's an admit snippet, an age snippet, an every 60-day snippet, and a follow-up visit. So we'd always want to start with an age. This is a however many years old patient with a primary diagnosis of. If it's an admission, you'll want to click admission, saying that you've done an extensive chart review. You've included the initial chief complaint, the progress notes, vital signs, lab results, diagnostics, etc. If this is a follow-up, there is a follow-up visit that says that you've reviewed their medications, their vital signs, any progress notes that were written either by endocrinology, wound care, psychiatry, cardiology, etc. If they have a blood pressure log that you've reviewed and they're on an antihypertensive, that's perfect. If they're not, you can delete that. Again, snippets are to be edited or deleted. Blood pressure or blood glucose log reviewed. We said that this patient was being seen for diabetes. So hopefully we're looking at the blood glucose log. Therapy progress reviewed, whether that's by the patient, the nurse, or the therapist. And then any new labs that are ordered. You can list them here, but you'll also be listing them under the lab section. So you can actually just backspace and put a period there. And then every 60 days, you're going to want to make sure that your past medical, surgical, family history, and social history are reviewed. Allergies and code status will also need to be reviewed. So this is a note of a 45-year-old male with a past medical history. And then the first paragraph you can see is your hospitalization paragraph. It's 4 to 6 sentences about why the patient went to the hospital. And then your second paragraph you can see is how the patient is doing right now. So anything that you see, anything that the patient tells you, goes in that section. Coming down to the past surgical, family, and social history, those are things that you're going to have to either ask the patient or you're going to have to look in the history from the hospital. There is one snippet that is available. It says no surgical history noted, or you're going to hand type whatever history you come up from either the HPI from the hospital or from the patient. Under family history, you're going to write whatever their risk factors were for their family. Don't write reviewed or non-contributory. Any history is always applicable. And by writing reviewed, it means that you have identified that, but that the reader has not. When you click this box, there is actually one snippet that you can utilize. It says no significant family history noted. So if there's no history that's of significance, you can utilize that snippet as well. The social history should include marital status and religion, which are located on the face sheet if your patient is unable to communicate that to you, but you should be discussing that with the patient, as well as their occupation or former occupation if they're retired, as well as smoking, alcohol, or drug use. So there are two snippets here, one that says formerly a smoker and one that says denies history of tobacco, alcohol, or illicit drug use. Now, while I have only mentioned tobacco, alcohol, or illicit drug use, I have also added married, Catholic, and retired RN, because that is very important when you're doing a social history. Again, allergies and the code status come from the progress note. Your vital signs comes from the progress notes, as does your weight. Your physical exam, if you click on it, there are snippets there. If you are unsure of what snippets you're going to be utilizing, you can click down here and click the snippet, and you can see that AFib indicates irregular heart rate and rhythm. If that's not what you want to use, you can delete it. If it is, then you can absolutely put it up under cardiovascular. If you look at eyes, it will bring up vision impairment and glasses. If you bring up psych, it will say agitated, angry, hostile, difficult to redirect. You can delete what is not applicable and then utilize what is there. Again, taking the snippet, editing it, and updating. Short-term memory loss, short-term and long-term memory loss. Here is the skin section that talks about chronic cutaneous insufficiencies and dermatoporosis with poor skin turgor without a rash. There is an incontinent tab, so you can click incontinent. So a bowel and bladder, if they're only incontinent of bladder, you can click that. There's obese. Lab imaging, you can see that there is no red asterisk, but there is an information box stating that you're going to write the date of service and each lab reviewed. So if you're reviewing labs from 1/1/2025 and the labs are a CBC, CMP, and a TSH, then we're going to identify them here. Any labs that you want to order, you can write here. If you have a critical lab, if you've had a low potassium and you would like a lab tomorrow, you can always write tomorrow's date, and then you can write potassium level. That indicates that you have a specific date on when you would like that lab. Under assessment and plan, your very first diagnosis should be the reason why you're seeing the patient. So that would be your chief complaint. So your first diagnosis is going to be your chief complaint. Under here, for the purpose of time, I'm going to review 3 diagnoses. I'm going to review AFib, then I'm going to review schizophrenia, and then I'm going to review seizures. So starting off with the AFib. That is your diagnosis. Then we're going to go to the assessment portion of it. Well, the assessment is the patient is asymptomatic. So then there's another portion of the snippet that says that they're at high risk for bleeding if the patient falls, and monitor for abnormal bleeding or bruising. That makes sense if they're on Xarelto, Eliquis, aspirin and Plavix combo. If they're on digoxin or metoprolol, they would not be at risk for bleeding. This is a snippet that you must delete to make sure that it works. You cannot be monitoring for bruising and bleeding if they're on digoxin and metoprolol. So just remember, make sure you look at your snippet to make sure that it is appropriate. So the schizophrenia one, as well as the anxiety and the depression and the mood disorder, they all have choices. So is the mood stable or is the mood unstable? So let's say the patient's mood is stable. You're going to be monitoring for positive and negative symptoms. You're going to be monitoring for EPS. If psych is following the patient, that's great. If LCSW is following, you can write that as well. And then because your medications are already above under the medication tab, you can just write continue Seroquel. That is sufficient. You do not need to write the frequency, the dose, and the route. The last example I'm going to give you for your assessment is going to be seizures. Are the seizures stable? No recent seizures or recent seizure activity. Make sure you delete whatever is not applicable. So this could be stable with no recent seizures. Monitor for seizure activity. If they do not have a follow-up with a neurologist, you are going to delete this. We don't send every patient that has a history of seizure disorder who is stable and not having current seizures to a neurologist. Only if they have an appointment would you keep that portion of the snippet. And then if you have any seizure medications, then you can leave that. If you've got recent seizure medications, you can write whatever those labs are. You can write 1/1/2025 Depakote level 55. And then you're going to write whatever medications they're on. So there's your assessment. Under consultation and collaboration, there is an asterisk, it's required. You can click nursing staff automatically because you are going to collaborate with every nurse on every patient. There is a family snippet that says that you've talked with the family. You can also utilize the other ones, including physician, the psych NP, social services, etc. Time or medical decision making, you have your 20 minutes, 30 minutes, and 45 minutes. This was an admit, so I'm going to click admit first, then I'm going to click 45 minutes. You also have that family snippet that you can utilize. And I use Dragon, so there's a dictation snippet. So that's what my time would look like. If this was not an admit and you were not using time, there are two different sets. There's a moderate risk and a high risk. So this could be a high risk for an with an exacerbation, a high risk, a moderate risk with two or more stable chronic illnesses. So if you don't know which snippet to use, click one of them. You can click a moderate with one acute illness, and then you can also click exacerbation of a chronic illness. You can click progression. You can click that you've done a referral or that there's actually a worsening of symptoms. So utilize whichever ones are appropriate for your patient. There's an advanced care planning note. The difference here is that you're going to put today's date. That's the only difference. You're going to put your 16 minutes. And when you click into this box, you have your two snippets. There's your discussion with patient and discussion with power of attorney. Again, this is the same as before. You've got your generalized statement that says you've had a voluntary discussion with a POA. And then every section from there on out has to remain. You cannot delete an entire section. You leave the section, which ends up being a sentence, and you delete what's not applicable. So the discussion was not held with a patient because of their lack of decision making due to, and then what's your answer? Dementia. So you would delete the not applicable information. Recent health status change or advanced care plan wishes that prompted this discussion. Maybe it's a new service provider, you're new to the patient, or the guardian has changed, or the patient is declining. Delete whatever is not applicable and then move on to the next one. The goals of care for the patient include curative aggressive or non-aggressive or comfort focused. So you're going to go through each of the snippets until you're all the way done at the bottom. And then you either use 16 minutes, or if it took you longer than that, you count those minutes. Your smoking cessation is the same. You've got your initial and your subsequent. It again is a snippet of deletion. The patient is a current tobacco user. And this statement says you've had a discussion with a patient and the patient desires to stop smoking. So you're going to put into place measures to help them stop smoking. So again, don't delete any section, but delete what's not applicable to that specific section. So for example, the patient smokes cigarettes, you're going to delete what they don't smoke. Their use of tobacco is several times a day, so delete what is not applicable. The years that they've smoked, you're going to delete what's not applicable, and then you're going to have your answer there. You're going to complete that for all sections of this. There are two different answers. There's 3 to 10 minutes, and there's greater than 10 minutes. So now that you've completed your entire progress note, you're going to scroll back up to the top and you're going to work on your ICD-10 codes. And so for this patient that has diabetes, we're going to select E11.22. Let's say that they have diabetes with chronic kidney disease. So we're going to select this, and then we're going to move on to the next one. Let's say they have I48.91. You can utilize this by searching, and then you're going to pick, they're both the same ICD-10s. This is just how they'll show up on your progress note. So I'll select that. You will continue doing these in the exact order that you put your assessment and plan. And when your list is done, you can X out of this box. Under your CPT codes, you're going to do the same thing. You're going to code your evaluation and management first and come down here and search. Now you're going to determine if the patient is short-term or long-term. This really makes a difference. Make sure if they're on a Med A part stay that you're clicking short-term, or if they're long-term, you're clicking this. The same CPT codes, but it has a different place. So we're going to say this patient is short-term. You're going to do advanced care planning. Again, the patient is short-term, so we're going to select this. And then we're going to do smoking cessation. The patient is short-term, so we'll select that. And when we're done, we're going to X out of here. So at the top of our note, we have our ICD-10 codes, and then we have our CPT codes. When we feel like our note is all the way complete, we can save as a draft. If we're going to go home and work on it later, we can pull it back up and we can submit it and attest it when the note is completed. Save that as a draft. So that is how to put a note into the computer as a nurse practitioner. You can either do an initial note or a follow-up subsequent note. You are going to go in under the section that gives you clinical notes almost every time. Unless you are looking for a patient, clinical notes is where you're going to be. So if you have any questions, of course, you can always reach out to me and I will follow up. But in the meantime, happy documenting and thanks for tuning in. Thanks for taking your time to do this. Have a great day.